I'm Brad Brown. I'm a nurse and clinical faculty here at Harbor College. Since June of 2006, we've been here doing simulation. Simulation integrates theory, which you get in the classroom, and practice, which you get in a nursing lab. And for example, instead of just telling somebody they need to put in a Foley catheter, we have our mannequin complaining of the need to urinate but unable to void. The student would have to then go to the chart and maybe call the doctor. So it takes it to the next step. We have two rooms here in the sim lab. We have the control room and we have the patient room. The group is usually consists of two nurses and one confederate, who will most normally be some kind of family member. There's a group of students in the debriefing room, and they get to watch on television. Getting students together and putting them in time-pressured situations where they have to perform gives them a sense of reality. When they go to clinic in the hospital, there's always an instructor that has to approve everything they do. So here in the sim lab, there is no experienced person. They have to make decisions on their own based on their findings. And then they get the privilege of carrying those decisions through and seeing if they were correct. For example, if they give the wrong medication the wrong way, the patient may have an allergic reaction and become very, very ill. But we can stop and go to the debriefing room and talk about it. And 3 minutes later, the simulator, the mannequin, is alive again. So they're spending at least 16 hours a semester here in the sim lab, learning how to make decisions, how to think, what to involve. They're learning not only by themselves, standing here doing the work inside the sim lab with the patient, they get to learn also from the debriefings and watching the other students in their group. In the briefing, we talk about the different problems that come along. Here at Harbor College, every semester, students get to come into the sim lab. We start off in first semester in what we call what's wrong with this picture. For example, we would put the bed up in the air with the bed rails down, where the normal clinical pattern is to have the bed in a low position with the upper side rails in the up position for safety. And as soon as that period is over, we start them in real live patient contact. Of course, that real live patient contact is mannequin contact. And a session is most normally 6 hours long, and you'll go through several different situations within that day, and we go back and debrief. And the situations naturally become more complicated as the students progress in their education. Here in the sim lab, they get to take a lot of information that they're given and make decisions and have to do it in some kind of real time. It is learning, it is safe learning, so that they can make the mistakes and learn and not injure a patient. Our instructors here are very progressive. They're pushing the limits for the students, trying to get them as many experiences as possible. We go to the local area hospitals and we spend lots of time in simulation. We spend more time in simulation than most other nursing schools because all of our students are required each semester to come to sim for each class.